is Dr. Michael Lacey from Mid-Atlantic Chiropractic. I'm going to answer the most Googled questions about chiropractic. So, do chiropractors actually help? Well, actually help what? Yeah, we help with a lot of things. I mean, people come to us for back pain, neck pain, headaches, but there's other things too. Chiropractic can help with stress, can help people sleep better, can help people with fatigue. So, and it's a chiropractic lifestyle too overall. So yes, chiropractic actually does help because I wouldn't be doing it if it didn't. Do chiropractors hurt? Do chiropractors hurt? No, the adjustments are gentle. Most people love getting adjusted. Now, sometimes someone might be in pain already, and the chiropractor will need to go in and get through that. But generally, chiropractic doesn't hurt in general. Do chiropractors take insurance? Yes, a lot of chiropractors do take insurance. In our office, we do not. We feel that the insurance companies will dictate the type of care they provide. So in order to get the best care, we want to be able to control how we take care of our patients. So, but most chiropractors do take insurance. Yes. Do chiropractors make a lot of money? Some chiropractors do. Yeah, I mean that's not the main reason why I got into the profession, but yeah, some chiropractors do make fairly good amount of money. Not as much as like neurosurgeons and stuff, but we do make decent money in general. Do chiropractors take the Hippocratic oath? Not the Hippocratic oath. We have our own oath, but yeah, I'm familiar with the Hippocratic oath. But we have our own oath. I don't remember it at all. At all. but we don't take the Hippocratic oath. The chiropractors give doctors notes. Oh yes, we do provide doctor's notes. I was trying to understand what that meant. Yeah, we do provide doctor's notes for people who maybe they're coming in during if it's a child coming in during school, or somebody who has back pain and they need time off from work or what have you. Sometimes that they'll need a doctor's note, and so we can provide those. Do chiropractors prescribe medications? No, we don't prescribe medications. We might recommend supplements, but in chiropractic school, we don't learn a whole lot about medication. That's kind of where chiropractic and medicine diverge in their education, because we don't go too much into the pharmaceutical side. We are more about understanding the body is self-healing and self-regulating. And so if we can help you without medication or as little as possible, then that's where we're going to go. And do chiropractors actually fix anything? Do we fix anything? Well, yeah, I like to think we do. I mean, we do help restore curves in the spine. Not a lot of professionals can say that, but if you take before and after X-rays, objective findings, yes, chiropractors actually do fix things, and if we didn't really fix things, I don't think the profession would be around anymore. Next question. So why do chiropractors call themselves doctors? Well, because we are. We're not medical doctors. People often say, our chiropractors are real doctors. Well, I mean, what is your definition of real doctor? The definition of a doctor is a teacher, so chiropractors do teach. And we don't have a medical degree, but we do have a degree in chiropractic. Like there's a degree in physical therapy, and there's a degree in philosophy. There's a degree in chiropractic, and it's called a doctor of chiropractic. Why do chiropractors scrape skin? There's some chiropractors who do. It's a soft tissue technique, but not all chiropractors do that. There's some chiropractors only focus just on spine and the joint. Some chiropractors do both, and they do soft tissue work. But it's more about breaking up adhesions in the skin. I guess that's what that question is asking about. But I don't do that. Why do chiropractors get a bad rep? That's a loaded question. It's a long history behind that. There was a goal to try to get rid of chiropractic from American Medical Association. That was you can look it up, but there was a lot of trash talk about chiropractic, and at the same time, chiropractors weren't really good at communicating the benefits of chiropractic too. So it's kind of a combination of things, but that could be a whole topic in and of itself that I don't want to get into right now. Why do chiropractors crack your back? Chiropractors focus on the spine because that's where our spinal cord is. The nervous system controls everything. The nervous system is the master system. So when there's misalignments in the spine, if the spine is not moving the way it's supposed to, then those nerves, the spine's going to be affected. Those nerves that go from your brain out to every cell, tissue, and organ in your body is going to be affected. And so what chiropractors do is look for those areas of misalignments, of fixations, and we restore that to allow the body to function properly. So that's why, and not all chiropractors crack either. There's a bunch of different techniques that we can use to do that too. Why do chiropractors use ultrasound? Some chiropractors use ultrasound, more of a therapeutic technique. We don't. We're in our office. We leave it more in the to the physical therapist to do those. Why do chiropractors use drop tables? Good question. Chiropractors use drop tables to allow gravity to assist the doctor with the adjustment. Imagine if we're adjusting every day, all day, and doing a twisting and bending people around all the time. It puts a lot of wear and tear on our bodies, and so some chiropractors use a combination, like we do. We use the combination of the twisting and everything, but also we do the drop tables, and that kind of assists with the adjustments, and it's just as effective. Do chiropractors crack ears? Chiropractors adjust ears. We do adjust ears, and it's more kind of the ear canal. So not, I guess it is kind of the ear, and it does pop sometimes. Sometimes it doesn't, but it's we find it helpful for especially for children with ear infections. People who have allergies, they feel a little stuffy, will adjust their ears. I personally don't like the adjustment on myself, but it's effective for myself, so I get it done as well. Next question?
That's all the questions.
Oh, okay.